Dr. Eric Meyer is the Program Director for Clinical Rehabilitation and Mental Health Counseling. Dr. Meyer, would you like to introduce yourself?
Sure. Thanks, Nicole. Yes, I'm a professor and I came on board about a year ago to direct this clinical training program.
Now, there we go. Could you briefly describe the Clinical Rehabilitation and Mental Health Counseling Program? And for all of us here, could you also tell us what is rehabilitation counseling?
Sure. Yeah. So rehabilitation counseling is a subfield within the broader profession of counseling, in which we work to help people who are living with a variety of emotional and physical disabilities to be able to live more independently, more sort of rich, fulfilled lives. I think that people are more familiar with mental health counseling, which is really focused on helping people to reduce symptoms associated with mental health or psychological problems. In rehabilitation counseling, we also address the mental health aspects and the adjustment difficulties associated with living with disabilities. But we also recognize that major aspects of the disability are not going to be reduced or go away. So it's about living the most rich, fulfilling life that one can, with the disability. And so our program really focuses on sort of rehabilitation specific and broader mental health aspects of counseling. And we really try to bring those two elements together into kind of an integrated, holistic approach to training mental health counselors.
So is this program, beyond integrating rehabilitation counseling with mental health counseling, more in the day-to-day coursework, is this program unique in how it trains future counselors?
So we take a very hands-on experiential skill training approach. So, our students do attend lectures, but we really try to minimize the amount of didactic lectures in favor of hands-on skills training. So, for example, we do a lot of, we hire professional actors and so forth to come in and role play clients. We prefer to see students demonstrate their skill acquisition through these role plays and demonstrations rather than through written exams and papers. So we really try to balance the sort of pure academic side with very practical hands-on skill training.
And who would be a good fit for Pitt's counseling program?
Sure. So certainly someone who's interested in the helping professions, someone who is interested in gaining exposure to kind of a wide variety of clinical topics, challenges, health conditions, struggles that people live with, kind of the full sort of range of human experiences and human struggles, if you will. Required skills to excel in our field include having really strong verbal communication skills, certainly, a degree of, as in any field, but maybe particularly in counseling, emotional maturity, sort of emotional intelligence, if you will. Those are all important aspects of a successful counselor trainee.
Now, you have a few counseling specific scholarships, and I've been noting these because not all of our graduate programs have these kinds of scholarships available. Could you tell us a little bit about the scholarships available through the program?
Yes, we're very fortunate. About a year and a half ago, we obtained a large training grant from the U.S. Department of Education to provide full tuition scholarships for 5 students who are interested in pursuing specialized training and working with folks with visual impairments, blind and visually impaired. We'll be accepting 5 students for the upcoming, into our upcoming class. We have a second set of partial scholarships donated by, through a philanthropic gift from someone who has a long history of association with our program. I think that those scholarships fund 1 to 2 students a year at about a third of the cost of tuition.
wonderful. It's a great opportunity for sure. Now, jumping over into admissions, what are you looking for? We can see here that you don't have specific courses required as part of your prerequisites. So what are you looking for from a student who's applying to the program?
That's right. There are no formal prerequisites in terms of coursework or degree. Probably our most common undergraduate degree is in psychology, but that's not required. We're looking for students with strong academic skills, strong GPAs. We include a number of essays to really try to identify students who are able to demonstrate a sincere interest and commitment to the field of counseling. And we also want to be somewhat or reasonably clear and confident that students understand some of the distinctions between counseling as opposed to, for example, going into a more research-focused degree such as clinical psychology.
For a student who thinks they're interested in counseling, but they're really not sure, this isn't like physical therapy where you can go and just shadow a PT. That's probably not going to be permitted in many cases. Do you have any suggestions on classes or work or volunteer work that students can engage in to get a sense for what counseling is like?
That's a great question. We, from time to time, do offer an undergraduate course that's cross-listed with psychology that's kind of a survey or an introduction to the field of rehabilitation counseling. Other than that, I would encourage people to volunteer if they can identify an opportunity with a community mental health agency or some sort of a state facility, perhaps that might provide opportunities to just volunteer and probably not to deliver any direct services, but just to gain exposure to these populations or to the professionals that staff them.
Are there any experiences in particular that help a student stand out when applying to the program?
I think, most of the students or all of the students that we accept are strong academically. So, once they sort of cross that threshold of high GPA, we read their essays quite carefully and letters of recommendation. And we're really trying to select for emotional maturity that sort of demonstrated interest and commitment to, really, being someone who is there to sort of serve the needs of others and to walk with people and kind of be a guide in their life journey. That's requires a level of maturity that's at a pretty high level for particularly people just coming out of undergraduate experience. So they have to find some way of demonstrating that through their written essays.
Here is a look at some of the 3-year averages for admissions with the counseling program. You mentioned students coming right out of undergrad just a moment ago. Do you see many students coming back after they've worked for a couple of years or as kind of second career students?
We do, and we really try to, pull together a mix of students. Most of our students do come straight from undergraduate, but we do try to identify those who are, quote unquote, non-traditional in the sense of having worked before returning to school, so that we have a mix of people with, kind of lived experience out in the workplace. We think it really adds to the cohorts of students that we are trying to build.
And do you require an interview as part of that application process?
We do not require an interview. We've set up a series of opportunities to meet faculty, presentations, and sort of Q&A sessions in the months leading up to the application deadline. And then we also offer similar sessions for students who are accepted into the program so that they can make an informed decision about whether to accept that offer. And we'll set up a call as on an as needed basis with any student who requests to speak with a faculty member. But no, we don't require an interview.
Okay, so could you tell us a little bit about your outcomes? The certification students are eligible to sit for, their pass rate, where they go on to work, those sorts of things.
Yeah, absolutely. We're very proud of our record. We have a virtually perfect certification exam pass rate. So at the end of their time in our program, students can sit for the one of two or both certification exams. Beyond that, there is additional study beyond graduation from the program of supervised experience necessary to gain licensure. In employment outcomes, we're always, hovering around 90+% employment within 6 months. All the U.S. labor statistics are pointing toward just almost explosive growth in the field of counseling. And so, we expect that to continue. In terms of some of the most common places where our graduates obtain employment, very commonly it's in community mental health or behavioral health clinics. Some of them work in schools and universities, substance use recovery centers, vocational rehabilitation facilities, and there are others, but I listed some of the most common.
Is there anything else that you think the undergraduate advisors, the University of Pittsburgh, should know about the counseling program to help the right students find you?
Sure. I think that there is a misconception that someone needs to have earned a PhD in order to be a counselor or a therapist. That is not true. Our program trains entry-level, master's-level counselors who are employable as rehabilitation / mental health clinicians in a wide variety of settings. What I often tell people when they ask, do I need to get a PhD or is a master's sufficient? It really comes down to whether, the types of professional activities that they want to engage in. And if they really are, purely strongly interested in being a clinician, then our program is a very, we provide outstanding training in a relatively short amount of time to get people out there into the field working in their chosen profession as clinicians.
A relatively short amount of time. How long is the program?
5 semesters.
All right. Now, do the advisors have any questions about the program? I do see one in the chat. What's the best way to explain the difference between counseling and therapy to students interested in the clinical mental health field?
So I think that one could argue that those terms are synonymous. People will argue for distinctions in those terms. I don't think those distinctions are particularly important. So I would discourage anyone who's hung up on the difference. In broad strokes, counseling is sort of a broader term that refers to, providing guidance to people struggling with a very broad range of life challenges, whereas therapy is maybe a narrower term, more focused on addressing specific health problems. So if one were to make the distinction, that's it. But given that we train people in mental health counseling, the distinction kind of falls apart.
The comment is, thank you for this clarification. Any other questions for Dr. Meyer? Nope. Okay, well, thank you so much, Dr. Meyer, for joining us today. We appreciate your insights into the counseling program and the time that you've spent with us here this afternoon.
Thanks for having me. Take care.